A lack of warmth, empathy, and understanding is another component of the Hippocratic Oath, which I wasn't aware of, and probably most people aren't. But in what ways are you convinced that providers are missing the mark in that department?
Yeah, um, a lot of it is because we don't have time to commit to patients and general practitioners, for example, but even specialists and others. They earn their money by throughput, by seeing how many patients they can cram into an hour. That doesn't really lend itself to listening to what the patient has to say, and perhaps having a chat to them, um, and letting them know that, reassuring them, letting them know that it's okay. That sure, they've got a bit of back pain, but it's very common. It doesn't necessarily mean that there's anything harmful. They don't have any red flag signs, and so it's probably better off if they just see this through, and they'll be okay, and explain to them why they don't need an MRI scan, for example. But and I hear this from surgeons all the time. They say, you know what, it's easier just to send them off for a scan because that takes 5 minutes. And or if they come in with a sore knee and they've got a degenerative knee, they say, it's actually easier to do a scope on them than to explain to them why they don't need it, and to sort of reassure them. And sadly, that's the attitude of some practitioners. And so I think that the the idea of just being a reassuring, sympathetic ear to some people is lost in the idea that we've just got to get people through the door.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.